Have your feet become colder than they used to be? Do your legs sometimes feel heavy when you walk? Or do you tire more quickly climbing stairs? These symptoms can have many causes, and they should never be ignored. But there is one small molecule that plays an enormous role in how easily blood moves through your body. It is called nitric oxide. Your blood vessels produce it naturally. It helps the arteries relax and widen, allowing blood to move more freely. But as we get older, our blood vessels may not produce or use nitric oxide as efficiently. The good news is that 3 ordinary foods can support your body's natural nitric oxide pathways, and the final food has been studied specifically in older adults. Stay until the end, because I'll also reveal one common mouthwash mistake that may interfere with how your body converts these foods into nitric oxide. Before we begin, remember that food cannot diagnose or cure poor circulation. Cold feet, leg pain, numbness, swelling, or changes in skin color can sometimes indicate peripheral artery disease, nerve problems, blood clots, or other medical conditions. If a foot suddenly becomes cold, pale, painful, or weak, especially on one side, seek urgent medical care. This video is educational and should not replace advice from your healthcare professional. Imagine that the inside of each artery is lined with millions of tiny cells. This lining is called the endothelium. A healthy endothelium releases nitric oxide. Nitric oxide sends a message to the muscles surrounding the artery: relax and open. As the artery relaxes, blood can flow more easily. That helps deliver oxygen and nutrients to your muscles, heart, brain, and other tissues. Your body has 2 main ways of producing nitric oxide. The first uses an amino acid called L-arginine. The second begins with natural nitrates found in certain vegetables. When you eat nitrate-rich foods, helpful bacteria in your mouth begin converting the nitrate into nitrite. After you swallow it, your body can convert some of that nitrite into nitric oxide. That means your mouth, stomach, blood vessels, and food are all working together. But this does not mean that one serving of vegetables will suddenly clear blocked arteries. The goal is to support healthy blood vessel function as part of a larger plan that includes movement, sleep, blood pressure control, and medical care when needed. If you appreciate clear health information without miracle claims, subscribe and join our senior health community. Now let's begin with food number 3. Food number 3, watermelon. Visual: fresh watermelon being sliced. Food number 3 is watermelon. Watermelon does not work in exactly the same way as beets or leafy greens. Instead, it contains an amino acid called L-citrulline. Your body can convert L-citrulline into L-arginine, which can then be used to produce nitric oxide. Research involving watermelon and L-citrulline has produced mixed results. A single serving should not be expected to transform your circulation. However, some studies suggest that regular consumption may support nitric oxide availability and vascular function, particularly in people with elevated blood pressure. Watermelon also provides water, potassium, vitamin C, and lycopene. A reasonable serving for many people is approximately 1 cup of cubed watermelon. You can enjoy it as an afternoon snack, add it to a salad, or combine it with plain yogurt and a few nuts to slow down the meal. However, watermelon still contains natural sugar. If you have diabetes, monitor your portion and follow the eating plan recommended by your healthcare professional. And here is another important point. Watermelon supplements are not automatically better than watermelon itself. Concentrated products can deliver much larger amounts and may interact differently with medications. Whenever possible, begin with ordinary food. Tell me in the comments, do you enjoy watermelon by itself, or have you ever added it to a salad? Now, food number 2 provides nitric oxide through a different pathway. Food number 2, leafy greens. Food number 2 is leafy green vegetables, especially arugula, spinach, lettuce, and similar salad greens. These vegetables naturally contain nitrate. After you eat them, nitrate becomes part of the nitrate to nitrite to nitric oxide pathway we discussed earlier. A controlled trial using spinach found improvements in certain measurements related to arterial stiffness. Other studies have found that nitrate-rich vegetables can raise nitrate and nitrite levels in the blood and may produce modest blood pressure benefits. However, not every study produces the same result. Your overall diet, medications, oral bacteria, and existing health conditions all influence how your body responds. For a simple serving, begin with 1 or 2 loosely packed cups of raw greens. You could make a salad with arugula, tomatoes, cucumber, olive oil, and lemon. You could place spinach in an omelet or add leafy greens to soup shortly before serving. Avoid turning a healthy salad into a high-sodium meal with excessive processed meat, salty cheese, or bottled dressing. Here are 2 safety considerations. First, leafy greens contain vitamin K. If you take warfarin, you usually do not need to eliminate them, but you should keep your intake reasonably consistent and follow your clinician's instructions. Second, certain greens can be high in potassium or oxalate. People with kidney disease, high potassium, or a history of calcium oxalate kidney stones should ask their clinician or kidney dietitian which greens and portions are appropriate. Spinach is particularly high in oxalate. Arugula, lettuce, cabbage, or kale may be alternatives depending on your medical needs. The goal is not to eat enormous bowls. It is to include an appropriate amount regularly. And now we come to the food shown in the thumbnail, the food with some of the most direct research involving dietary nitrate. Food number 1, beets. Food number 1 is beetroot. Beets are naturally rich in dietary nitrate. Your body can use this nitrate to support nitric oxide production. In one small randomized pilot study involving healthy older adults, participants consumed beetroot juice for several weeks. After 2 weeks, the beetroot group experienced average reductions of approximately 6 points in systolic blood pressure and 4 points in diastolic blood pressure. Researchers also observed improvement in one measurement of large vessel endothelial function. These results are encouraging, but this was a small study involving only 20 older adults. It does not prove that everyone will experience the same change. Beets also do not remove arterial plaque, replace blood pressure medication, or cure circulation problems. For most people, a practical food portion is approximately half a cup of cooked beets. Try roasting them with olive oil and pepper, adding them to a salad, or blending a small amount into a smoothie. If you buy pickled beets, examine the label. Some products contain large amounts of sodium or added sugar. Beetroot juice is more concentrated than whole beets. Because it may lower blood pressure, people who already have low blood pressure or who take medication that lowers blood pressure should speak with their healthcare professional before using concentrated beetroot juice regularly. Beets can also temporarily make urine or stool appear pink or red. This is often harmless, but unexplained blood in the urine or stool should never automatically be blamed on beets. If you are uncertain, contact a medical professional. If this information is helping you, tap the like button. It tells YouTube to share this video with more older adults who may benefit from practical, responsible health education. Now let's discuss the mistake many people never hear about. The mouthwash mistake. Your mouth is not simply the doorway to your digestive system. It contains bacteria that help convert dietary nitrate into nitrite, an important step toward making nitric oxide. Research suggests that strongly antiseptic mouthwash can temporarily disrupt these nitrate-reducing bacteria. That does not mean you should stop prescribed mouthwash or neglect oral hygiene. Gum disease is itself associated with significant health risks. However, if your dentist has not prescribed an antiseptic rinse, avoid repeatedly using strong antibacterial mouthwash immediately before and after every nitrate-rich meal. Ask your dentist which product is appropriate for you, especially if you have gum disease, recent dental work, or an oral infection. You should still brush your teeth, floss, clean your tongue gently, and attend regular dental examinations. The message is not mouthwash is bad. The message is that the oral microbiome is more important than many people realize. Chewing your vegetables thoroughly also mixes them with saliva, allowing the digestive process to begin naturally. Simple daily plan. Here is a simple way to use all 3 foods without turning your diet upside down. At lunch, prepare an arugula or lettuce salad with half a cup of cooked beets, tomatoes, olive oil, and lemon. In the afternoon, enjoy approximately 1 cup of watermelon. At dinner, include another colorful vegetable with your protein and whole grain or bean portion. Then, if your doctor says walking is safe for you, take a comfortable 10-minute walk after one of your meals. Movement encourages blood vessels and muscles to work together. You do not need to walk quickly. Begin with what feels safe, use your walking aid if needed, and increase gradually. Remember that circulation depends on more than nitric oxide. Smoking, uncontrolled diabetes, high blood pressure, high cholesterol, inactivity, and excess sodium can all damage blood vessels. Addressing those factors is more powerful than searching for one miracle food. Before adding large quantities of nitrate-rich foods or concentrated beetroot juice, speak with your healthcare professional if you take blood pressure medication, regularly experience dizziness or fainting, use medication for chest pain, have kidney disease or elevated potassium, take warfarin, have recurring kidney stones, or have been told to restrict fluids, potassium, oxalate, or vitamin K. And please remember, persistent calf pain while walking, wounds on the feet that heal slowly, one foot becoming colder than the other, or unusual changes in skin color deserve medical evaluation. Watermelon provides L-citrulline, which may support the L-arginine and nitric oxide pathway. Leafy greens provide natural dietary nitrate, and beets are a concentrated food source of nitrate with encouraging, but not miraculous, research behind them. Eat them as part of a balanced diet, choose sensible portions, and combine them with regular movement and appropriate medical care. Which of these 3 foods will you add first? Watermelon, leafy greens, or beets? Write your answer in the comments. Share this video with a friend or family member over 60, and subscribe for more clear, practical guidance on circulation, strength, digestion, sleep, and healthy aging. Thank you for watching. Take care of your body, stay curious, and I'll see you in the next video. Watch next. Weak legs after 60? Check these 3 nutrients first. Subscribe for weekly senior health guidance.